With many partners and collaborating scholars in Asia, I've been long looking at issues of healthy aging and particularly about chronic disease control. And we use diabetes mellitus not only because it is an important condition that many people suffer from, but as a lens to understand how managing complex chronic diseases occurs within different health settings and health systems, and how to support those individuals so that they don't develop complications and suffer premature mortality. And so I've been working with colleagues in India, applying methods that we've developed previously using data collected from the Center for Cardiometabolic Risk Reduction in South Asia, one of their cohorts, the CARS cohort that we look at in this study. Then we chose 2 sites from that and 2 from the other one that was India Uday, it's called, but then we have 4 different sites, and that so Delhi, Chennai, Haryana, and Vizag, and that included urban and a couple that also are rural, which is a very important distinction. And so for this study, we thought, given the pandemic, maybe we could try to provide some insight for policymakers and caregivers and others by looking at these same individuals that we already know something about what's happened to them previously, some of their sociodemographic background, and they were being managed for diabetes and or hypertension, so that we could follow up and see how the pandemic was impacting them. So the research was based on these 2 cohorts in India, working with collaborators there. You talk to people, so that's a qualitative component, and ask them how they're doing, as well as gather quantitative data through a survey and other methods and analyze the data. And you use both of these methods together to understand what's really going on. And both approaches have pros and cons, but putting the qualitative and the quantitative methods together, you get a fuller picture of what is happening to these people and what possible, approaches might be. So a typical question might be, you find something in the quantitative data and you think, oh gosh, we didn't ask that question. What is driving this result, right? But then the qualitative interviews, you can take direct quotes from what people are seeing and you understand better what's going through. And so by combining quantitative and qualitative methods, you can get at some of those issues that cannot be fully covered with just one method or the other. We found that it's been very difficult for many people in India during the pandemic. This was data from last year, between July and September, collected from the 4 different sites. It was collected over the telephone, and we had a reasonably good response rate of people that had chronic conditions, around 74%. And so most of these people were in their 50s or 60s. There's a range. It includes urban and rural people, as I mentioned. We found, unsurprisingly, but very importantly, that the most vulnerable are the ones that are suffering the most. And this includes difficulty in access to healthcare and medicines, rural residents having lost income, having diabetes as opposed to having hypertension or some other conditions. So some of these factors were associated with having loss of access to care or reporting that their symptoms worsened, and a significant impact psychosocially as well, that they were not able to have the same kind of physical activity or diet, but also directly that people in their family had lost their jobs or had been infected with COVID, or others in their community had been. They were feeling fear and anxiety that many of us feel during the pandemic, but did not have the resources necessarily to also address their chronic disease. And this, of course, could lead to delay in care and later to more severe outcomes. So we tried to talk about issues that might mitigate that kind of impact And we do find that government support actually was protective, although it was quite small. And there are other aspects that are protective for people or help them to get through some of the more severe aspects of the pandemic. Unfortunately, there's no magic pill. So trying to reach out to the vulnerable and, for example, make sure that people in remote areas or people that have suffered an income loss have the ability to continue to have access to important medications for their disease could be critical going forward. Like for many other countries and settings, we know that care and access to care, self-management of chronic disease was not perfect even before the pandemic. So there are many things that need to be reformed so that health systems can reinvent themselves, sometimes called Build Back Better now, and learn how to integrate aspects that actually are helping sometimes to move resources around to a more appropriate setting. So for example, enable individuals themselves to manage their disease, or enable family members to support and know how to support their ill loved ones, to have community health workers that help to make that link. So obviously the most severely ill need to have access directly to a clinic or a hospital, but we also need to be able to use technologies and reaching out to local settings and in communities to make that kind of chronic disease management easier and supporting, because it's not just an acute episode where you treat it and then you go back to living a different way. You have to adjust your whole lifestyle so that you can prevent complications from developing. And it can be easy when there's so many other pressures on an individual to forget or prioritize something else. And it's also true that in some settings, older women or other particular groups are not given priority in household resources. So whole health systems need to try to adjust to use new technologies, helping with monitoring one's own condition, but also just to incorporate an attitude towards prevention and making people aware that even though they're not currently experiencing symptoms, if they don't adhere to certain kinds of behaviors and regular follow-up, that complications will arise and they'll have longer term effects. So this is challenging everywhere. The US system is far from a world example in that respect either. And we all know that behavioral change is difficult, but this is one of the areas that health systems need to creatively adapt. And during the pandemic, many things have been tried, and building upon those successes might lead to a more resilient, productive, and humane health system going forward.